The pressure is building on state lawmakers to do something to fend off the impending $1.3 billion budget shortfall without making huge budget cuts. Adding to that pressure now is a proposed 25% reimbursement reduction to the more than 14,000 Medicaid providers in the state. A cut that could be avoided by accepting money the state has done all it can to refuse.
Governor Mary Fallin, House Speaker Jeff Hickman, and Senate President Pro Tem Brian Bigman ordered the CEO of the Healthcare Authority to the state capitol this week to unveil a plan that will save the state's healthcare system from near collapse without expanding Medicaid. Nico Gomez showed off his plan to avoid a 25% cut to Medicaid providers, which is now slated to go into effect June 1st, a cut that would bring dire consequences to healthcare statewide.
I think kids will suffer. I really do. I think there will be delays in getting medications they're used to getting. I think there's services that they'll be denied because the providers that used to provide them aren't there anymore.
Once you break that infrastructure of care, you're going to have a very difficult long-term issue in terms of trying to fix what these cuts will do to the healthcare system in Oklahoma.
When a hospital closes, it is almost 100% certain it will never reopen. Sayre's closed, it won't reopen. Frederick has made huge changes. I can tell you there's probably a half a dozen other hospitals that I don't think may make summer.
If those cuts take effect, more than 90% of the nursing homes in this state will close.
Warnings that legislative leaders and the governor got an earful of this week in a meeting with hospital administrators, doctors, ambulance companies, and scores of other healthcare providers. The governor's large conference room was packed to standing room only. But there was a mixed reaction to the NICO plan. While many see it as holding out hope of a solution, others saw the meeting as preaching to the choir and falling far short of what needs to be done. Dr. Brian Lepley has been a pediatrician on the south side of Oklahoma City for more than 30 years. More than half of his patients are on Sooner Care, Oklahoma's Medicaid program.
I'm not sure how productive it's going to be. I mean, they need hundreds of millions of dollars, and I know it's going to be very difficult to find it, but the alternative is worse. So whatever they have to do, I hope they do it.
Dr. Lepley is facing a life-changing decision for his practice and his patients.
If I'm going to stay in practice, I have to decide by day after tomorrow.
Ken King is executive director of the Oklahoma State Medical Association, which represents the state's physicians. His board of directors has already voted to urge doctors to get off the Medicaid system. While he remains hopeful the NICO plan can fix the crisis, he also understands the resistance at 23rd and Lincoln to tax hikes.
It's hard to see how you solve this problem without some additional revenue coming into the state.
Chuck Skillings is the CEO of St. Anthony's Shawnee Hospital.
I think it's a very good plan. Plus, in addition to that, we have the ability to accept millions and millions of dollars back from the federal government that is our money anyway. We sent it. We have the opportunity to bring that back.
The Medicaid Rebalancing Act of 2020, better known as the NICO plan, calls for creation of a new Insure Oklahoma plan that provides access to health insurance for 19 to 64-year-olds under 133% of federal poverty. They would pay premiums on a sliding scale based on income. That would provide health care coverage for an estimated 175,000 people and cost the state $100 million. $900 million more would come from federal Medicaid funds. Then take 175,000 pregnant women and children off of Medicaid and into the private insurance market, where they would get subsidies, saving the state $60 million more. And finally, keep the reimbursement rate at its current 86% of Medicare by hiking cigarette taxes by $1.50 a pack and putting new fees on hospitals and health insurance policies. Politically, it's a plan that has some immediate support from Republicans in the legislature. Representative Doug Cox is an emergency room doctor.
Well, Nico's plan is in no way Medicaid expansion. His plan actually will decrease the Medicaid rolls and move some of those people into the private insurance market. But as we do in all aspects of government, it will involve accepting some federal money and using that to match our state dollars.
Democrats say while it appears to be a good enough plan, it continues to ignore the elephant in the room that could have solved this situation 5 years ago before it even began. Expand Medicaid.
So our caucus is in a position of saying, Governor, if you want to get serious about fixing the health care problems in Oklahoma, well, then show you're serious and bring our dollars home. Don't ask us to pay more. We've already paid plenty.
Earlier this week, there was an example of just how difficult it may be for the NICO plan to get through the legislature. The Senate Health and Human Services Committee took up a bill that would have forced 111,000 so-called able-bodied adults off the Medicaid rolls. But even the bill's sponsor could not explain what able-bodied meant.
If these individuals are receiving Medicaid coverage for their health care that are considered able-bodied, do we know how many of them are working?
Whether or not an individual is working full-time, part-time, casual labor, what have you, I think we're talking about individuals that are either not working, but they're not working full or even a regular part-time job.
The committee killed the bill. For Dr. Brian Lepley's 1,200 patients now on Medicaid, it is already difficult to access the state's Medicaid system, and there is uncertainty if there is even enough time for politicians to act and avoid making it impossible to access health care.
Be a voice for these kids who have no voice. You know, it's not just a column of numbers that they're trying to balance. It's really children that need services.